We have to look outside the box. We need to be creative, and telehealth gives us the advantage to do that. All you really need is a tablet or a phone, and we have a game-changing plan. I think that telehealth in urban situations, it's not necessarily deployed differently than it is rurally. I think it's maybe what the asks are for those clients that live in those areas. In urban areas, it tends to not be that they can't get access to the providers, it's that they don't have enough of them. All facilities, whether you're urban or rural, need to take a hard look at how they're utilizing telehealth across the continuum. So it may be that you have it leveraged in an outpatient clinic, or maybe only in your mental health space, or you've decided to use it as follow-ups for all of your postoperative care. See where you have gaps. Where can you access service lines for folks who are driving 75 to 100 miles to your facility, and maybe they could go to a sister facility and see all of your wonderful providers. Or maybe this is the opportunity for you to say, you know what, I've never leveraged endocrinology in my primary care clinics before. Our primary care folks are already so overloaded. How could we maybe enable an endocrinology clinic to run inside of one of our PC offices? Telehealth can be used in a multiple of modalities. For example, you walk into your rural emergency department and you wind up having a blockage, and that rural ED was able to get the scan and determine it, but now there's nowhere for you to go to have that consultation with that GI specialist to say what the next steps are. You are able to bring in a highly qualified GI specialist who can come in on video, do a peer-to-peer consult with that ED physician immediately, and speak to the patient. You're already checking off all the boxes: quality, safety, making sure that we're meeting that patient where they are. And the best part about all of it, we didn't delay the care, and hopefully we were economic about how we went about securing those opinions. I think that what telehealth needs to be used as is the first interventional step. It's a great intervention for, do you need more access to care? That's the goal, especially in primary care and in urgent care, where we could access people quickly. We can tell them what we think, get labs, run some simple diagnostics, and quickly move them into appropriate channels for when they need more advanced care and stop tying up our EDs. I think that it has been a game changer for mental health. It is the perfect medium for that, and you're providing life-saving care to that person who needs it, because otherwise they wouldn't have access. I think the future of telehealth for urban and rural communities is only going to increase. Everybody recognizes, I think, the crucial value that telehealth brings. So the goal, I think, is to enhance access. In rural areas, what changes is we're actually bringing the entire service line to those areas. They don't have access, they don't have that needed care, and so telehealth is the ability to provide that for their patients.